So I welcome you all to today's session. In today's session, we are going to discuss about a very important part of medical surgical nursing basically. As a nurse, we definitely have the role and responsibility to take care of every individual being who is seeking the help, right? Or who have the health needs. Now, it is a very important part to know that we should definitely be more careful while providing nursing care to the population who are known as vulnerable population. Now, it is a very important part of a nursing, or we can say it is very important role of a nurse to provide extra care to the vulnerable people. Now, we consider the people who are vulnerable, they have extreme needs and they are basically unable to meet their health needs. That's the reason here we have the major responsibility to take care of them in every aspect. So that's how here in today's session we are basically going to learn about the role of a nurse in care of the older population or older adults, right? Now, as we know, once a person is considered to cross certain age, they will be developing with various disease condition. Not only disease condition, because of the aging process, they will be very vulnerable to attacked by different diseases. Their immunity here will be deprived, their psychological condition, physical system, everything will be altered. That's the reason they need more specific care here. So in this session of today's, we are basically going to learn about the nursing role and responsibility in the care of old age people, what we also termed as the gerontological nursing. So gerontological nursing is the care of older adults based on the specialty body of knowledge regarding gerontology and nursing. Basically, we can say gerontological nursing collaborates two different body of knowledge that includes the body of knowledge of gerontology and the nursing. Collaboratively, it becomes a gerontological nursing. So here, if a nurse is responsible to provide care to the older population, they should be well aware about the aging process, regarding the changes which occurs in physiology and which occurs in psychological aspect or social aspect for an individual once they are a victim of aging process, that also should be well aware and clarified for a nurse before going to provide them effective treatment. Now, gerontological nursing, this is a specialized field as we have studied. Now here, the nurses will be approaching to the older adults or who are the victim of the aging process to them with the whole person. It is not only a care provided to them, but we will be considering here the physical approach, the psychological approach, developmental approach, socio-economic and cultural approach or perspective. So basically, we will be providing the nursing care to the older population based on physiological, psychological, cultural, socio-economical, and developmental perspective. Now, in older adults, cascade of disease process can occur. That's the reason here why a nurse should be very aware regarding each of the disease condition that may increase the chances of the development once the person is crossing a certain age, and also we should be well aware about their pathological changes which will be brought by the disease process for a particular individual. Also, we should be able to manage the client condition and provide the care depending on their need. Now, generally, the comprehensive geriatric assessment interdisciplinary. Now, here we're going to learn about what are the basic assessment should be performed by a nurse while providing care to the geriatric client. First, we should perform a thorough medical history. Like other patient or client who were approaching to the medical setup to seek medical care, here for the geriatric population also, we should definitely perform a thorough history collection. History collection includes about their personal data, present in past medical and surgical history. Also, we should definitely collect the history regarding the medicational chart which they are using, or regarding the medicational regimen which they are following right now. We should also assess their condition or their family history basically, and also we will be collecting the data regarding their lifestyle. Second assessment, what definitely a nurse should be provided to the client is the physical examination. So for geriatric population, it is very important to perform the physical examination at a regular interval. Now, as for example, we know that as with a male client, if they're reaching up to the age of 55 years and more than that, this particular age group is considered to be have a high risk for the development of prostate cancer. Now, the physical examination, why it is important is because if we are performing the physical examination at a regular interval for a geriatric population, we will be able to identify the early signs and symptoms of the disease progression. Now, as I have mentioned, once the person or a male individual is crossing the age of 55 years or 60 years, they are more likely to develop with certain disorder or disease related to the prostate. Now, if the physical examination is performed on a regular interval basis, we perform a digital rectal examination at a regular interval, we will be able to identify even if there is presence of any minimal changes that is occurring into the prostate, so that essential diagnostic tests can be carried out at the time, and as soon as possible we can initiate the treatment which actually prevent the disease progression and complication development. So that is the basic need why we should definitely perform a history collection and physical examination when considering a geriatric patient. The next assessment is the functional assessment. Majority of the client once reaching a certain age will be losing their functional ability. So it is our responsibility as a nurse to assess their functional ability. Not only we should assess their functional ability, also we should question them and we should try to collect the data related to the rationale behind the development of functional disability. Many people, once they're reaching to a certain age, they will be developing a psychological dependency due to what sometimes the clinical manifestations will be present, like physical disability, where they will not be able to perform even their activity of daily life. Now, this dependency can be actually counseled and person can be encouraged via definite scientific technique through which they can actually revive their activity of daily living, or the condition where they can perform their activity of daily living. So that is why it is very important for a nurse to perform the functional assessment, understand the disability of the particular client who are under the geriatric group. Also, we should definitely understand the rationale behind it, whether it is related to any disease condition or whether it's just a psychological condition where they are getting dependent on somebody to perform their daily activity. That has to be assessed and corrected. The next condition is medicational review. Now, mostly or most of the clients who are in a certain age group or who are considered to be the geriatric age group will be on certain medications definitely. Majority of the clients nowadays will be having problem like diabetes mellitus, hypertension, and so on, lifestyle associated disorders. So this has to be definitely assessed, and the medication what they are into, that also should be collected here, because majority of the cases we can see the as a side effect of the medications also the geriatric population suffer from various disease condition or various problems in their daily life. So that has to be assessed and managed. The next part or role of a nurse is the cognitive and mood evaluation. Now, psychological well-being or maintenance of the psychological well-being for the geriatric population is very important. That's the reason why we should definitely here assess their cognitive ability and their mood, so that we can understand whether there is any psychological changes that has occurred or that has affected the individual or not. The next condition which should be definitely assessed is the social resources. So many of the older population or the client who are present in the older population will lack social as well as interpersonal resources, due to what they can develop certain disease condition. Majority of the client can suffer from anxiety, depression, even they can a victim of negligence. So here, as a nurse, we should definitely consider their social and interpersonal resources to understand their status and to understand their psychological well-being. So I hope till here you are completely clear what are the major focused part should be assessed while talking about a geriatric client and their care. So after the completion of the initial assessment, definitely a interdisciplinary team approach can be initiated here to provide the care to the client and meet their daily need. Ongoing assessment also would be recommended, which definitely includes a physical assessment at a regular interval, mood assessment, assessment of activity of daily living, mental status evaluation, and social environmental assessment. It plays a very important role to identify any of the condition which seek the appropriate treatment and interventions. Now, once the assessment is done, next we are going to see the planning would be done generally by a geriatric nurse. Now, the priority goals in case of taking care of a geriatric patient includes improve the feeling of safety, reduction of the stress, gaining a sense of control and a sense of well-being. Now, majority of the client here will be not be having very much awareness about their own health and about the aging process. That's the reason most of the client will be very much anxious regarding the aging process. And due to that, due to various problems related to their physiological health, psychological health, due to the dependency of the economical condition on their family members, they will be developing stress and anxiety. Here, that's the reason the major goal of the nursing care plan would be reducing the stress and also improve the feeling of safety, because majority of the client will be dependent on somebody else. They will not be having various social economical resources. Even neither their physical and psychological health will be so much fit. That's the reason majority of the client have a feeling of unsafety. That's the reason here the nurses will try to improve the feeling of their self-needs. Gaining the self-esteem or a sense of control should be definitely be done while planning nursing interventions. So that's how generally we will be implementing the plans, or we will be setting the expected outcomes when taking care of the patient who are coming under the geriatric group. Now, here the nurses should definitely be flexible to modify their expected outcomes depending on the client's need, depending on the client's social, economical, and physiological and psychological status. Now, I hope you understood that as per the patient condition and their need, we will be definitely intervening different nursing interventions. Now, when we should implement these interventions, all the nurses who are handling geriatric client should definitely be follow certain point, or they definitely should keep this important point on their mind. This important point includes the nurses here, and their planning or interventions here should be modifiable and flexible, depends on the client's need and preferences. So, as a geriatric client, we should definitely be showing enough respect towards their preferences. That's the reason, as a geriatric nurse, we should be enough flexible and modifiable. Planning should be present with the nurses so that they can modify and flex their plans or interventions according to their need. Always, a geriatric nurse should show a slow and calm approach. Now, you need to understand many of the clients here may seem to be psychologically, anxious. They may show the expression as it is. So, as a geriatric nurse, we should understand their perspective, and we should definitely be always use a slow and calm approach when taking care of a geriatric patient. The next condition is adaptive equipment. Now, many of the clients will have difficulties in performance of activity of daily living. As a nurse here, we should assess their need, and we should definitely be supplying the adaptive equipment so that they will be easily perform the activity of daily living. The next approach is here, the nurses should always provide a detailed explanation to manage the anxiety of the client. Now, here at this age group, the client will be having various stress. They will be having stress regarding the dependency on somebody else. They will be having the economical stress. They will be not well aware about the aging process. That's the reason, because of the inadequate knowledge, they will be so much anxious and panicky. Here, as a nurse, we should definitely be very much free to discuss with their nature of the process, what is occurring. We should also here explain regarding the disease process, if there is any. We should also discuss with the client regarding the natural aging process and what can be the changes are expected, how it can be managed, that also has to be explained to the client. And if we are performing any procedure, that has to be explained step by step to the client in order to minimize their anxiety level. So I hope till here you understood that basically depending on the client's need, we are going to change and flex our interventions, and we generally will be following this certain approaches while approaching to our geriatric patient. Now we are going to read here regarding certain health promotive and preventive activity that would be performed by a nurse when taking care of a geriatric client. So most of the nurse who is handling a geriatric client should definitely be well aware about this fact that the client almost have a decreased tendency to maintain the self-care. So increasing the self-care ability here plays a very important role. That's the reason nurses here plays a very important role to improve their self-esteem, improve their body image. Also, we are the person who will be encouraging the client to maintain their self-care routine. The majority of the clients in this stage of life, they will be having fear and anxiety related to the aging process. Due to that, majority of the person will be tend to develop a particular type of dependency of their functioning. As a nurse, here we plays a very important role where we will be discussing with them about the natural process of aging. Also, we will be discussing with them the expected effect that may be present among them because of the natural process of aging. Also, here we play the major important role to improve and to encourage their ability to perform their activity of daily living. That's the reason here nurses basically will be encouraging regarding their independent functioning. That's the reason why we generally will be providing a safe environment, a complete accident free environment, and adaptive equipments, which definitely helps a person to perform their activity of daily living with more ease. Now, the third condition is we should teach the client related to the available resources which they can easily use and can perform the independent functioning. It is a very important role of a nurse, or we can say a health promotive or preventive role of a nurse, where they will be helping the person to identify the available resources that is already present in them. Now, if a geriatric client is present within a hospital setup, they need definitely a acute care, which definitely includes identification of adults who are present with a age group over 85 years with or without frailty. Now, it is considered that this age group is more vulnerable because these clients will be having certain risk associated with the performance of various treatment procedure. So while being in the hospital, definitely here as a nurse, we will be making the interventions and we will be implementing it. So already we have discussed the certain approach should be followed by a nurse when we are taking care of geriatric client. Now here, nurses also plays a very important role when comes to the discharge of the client from a hospital setup. So early in the hospital stay, we should basically try to identify or consider the discharge need of the client. That's the reason why we will be providing the assistance at early stage of discharge to the client regarding the daily living or activity of daily living, regarding administration of medication, maintenance of hygiene, maintenance of adequate diet, and a proper rest and sleep. While screening or dealing with the patient with geriatric group, definitely we should implement the standard protocol to screen the high risk client among the geriatric age group. So we will be implementing the mobility programs often to the geriatric client to minimize the functional decline for them. Now here we will be also trying to assess their available resources, their family support, and their role of the caregiver, and we will be trying to advocate for the referral of the client to adopt to a community-based services if available. So that's how generally we are going to help the client even to get adjusted after the discharge from a hospital setup. Now, care transition here plays a very important role. So it is basically a set of action that is designed to ensure a coordinated and continuous, a continuous health care provided to the geriatric patient. Generally here, the client or the geriatric client will be transferred between the different location or different levels of care within the same location. So as I have suggested that during the discharge time, a person's need should be assessed and they may be provided with some referral to a community-based services where they will be able to get the services at their doorstep in spite of getting the continuous treatment in the hospital setup. So that's how here basically the care transition will be taken care by the nurses. Now here we will be assessing the client's need and we'll be transferring the client in different level or the different areas where they can get their health needs to be achieved easily. So I hope till here you completely understood that nurses plays very important role in even in the acute care and even in the care transition. Next, we are going to learn about the rehabilitative care. Now, majority of the client are prone to develop certain disability with the aging process. So here, the nurses will be having a very major goal to help the older adult to recover or adopt from the disability that are developed with the aging process. Now, this may occur in a inpatient rehabilitation or a long-term care setting with proper training of the client, with the usage of assistive equipment and assistant to the personal care. Here, basically, the nurses will be providing all the necessary information to the patient, their nature of the diseases, their nature of the disabilities, the rationale behind why the rehabilitative care is given to them, that also will be explained to the client. Here, we will be assisting the client to perform their activity of daily living in order to ensure that they are attaining the independent functioning. Also, we will be providing necessary equipments and we will be teaching them the usage of it so that they can adopt with the changes with the aging process. So that's how we are going to basically provide the rehabilitative care for those clients who are present with certain disability. Now, older adults with chronic conditions such as stroke, arthritis, heart disease, which and severe disability related to any accident definitely needs a rehabilitative care to maintain their quality of life. So while assessing a client or taking care of a client in a rehabilitation center, definitely first we should identify the pre-existing problem associated with reaction time, visual acuity, fine motor skill, physical strength, their cognitive function, motivational effect regarding the rehab potential of the older adults. Secondly, we should understand the deconditioning is very common among the older clients. That's the reason why nurses here will be helps or assist the client to perform various passive and active range of motion exercise, which will be allowing the older adults to prevent deconditioning and subsequent functional decline of their activity of daily living. The third important point here is the nurse has to keep in mind that the rehabilitation is to basically strive the maximal function and physical capabilities considering the individual's client health status. So we should definitely understand the client health status. Then only we should plan a expected outcome or goal, and we should work towards that. So that's how generally we will be providing and we will be assessing the client while performing a rehabilitative care. Now, the commonly used assistive devices includes the dentures, glasses, hearing aids, walkers, wheelchairs, adaptive utensils, elevated toilet seat, and skin protective devices. Now, maintenance or maintaining the hygiene of all these devices, and managing these devices or usage of these devices should be demonstrated or educated to the client by a nurse. One more important concern when handling a patient in the geriatric age group is the safety, or we can say they are more prone for getting an psychological or physical accident or incident. That's the reason there are higher risk for accident because of the normal sensory changes, slowed reaction time, decreased thermal and pain sensitivity, changes in the gait and balance, and medicational side effect. That's the reason why here nurses should be very much well aware and should be very much focused to provide a safety environment so that the physical accident can be minimized here. Medication use is very commonly done by a geriatric population. That's the reason here a thorough and regular assessment should be done, a care planning should be provided, a evaluation should be done when the person is on a particular medication to identify the need of it. So that's how here our nurses would be providing a safer environment to the geriatric population. In order to reduce the psychological accident or incident, we definitely will be providing a very empathetic environment to the geriatric population, because you need to understand they will be so much emotionally vulnerable population. That's the reason here the nurse should approach with a very slow and calm manner. We should definitely define and explain each one of the planning of us when taking care of a geriatric population. Majority of the client in this age group may show certain psychological disorders, depression and anxiety due to the aging process, due to the dependency and economical outsource. So here definitely as a nurse, we would be definitely try to treat the client. We should have a very important role to counsel the client and also to understand their perspective. Here, we are the responsible person who will be improving the self-esteem for a geriatric client. That's the reason we should maintain a very empathetic approach while dealing with this vulnerable group of population. In case if a client have a very severe risk, restraint, basically physical and chemical restraints can be used to make sure that the person is safe from meeting a physical injury. That's how the nurses will be taking care of the geriatric population. Now, there are certain regular needs of a geriatric client which are same like as a normal person who are seeking medical or nursing care in an institution. Here, nurses also are responsible to meet the nutritional need of a client. As a geriatric age group, the client will be having disturbances even in their gastrointestinal tract system. There will be certain disability for the digestion and absorption method. As a nurse, we should understand the normal aging process and how the aging process can alter the gastrointestinal function. And if we are understanding it, then only we will be able to meet the need of a geriatric client. So here we should definitely understand the basic concept, the basic change which can occur in a gastrointestinal tract and the absorption and the metabolism function. Then we will be providing the adequate nutrition to them. Here, it is a very important point to note. The nutritional status should be monitored and maintained by the nurse, because also these people of geriatric age group will be having increased risk of development of infection, and they will be also having decreased immunological function. That's the reason why we should provide adequate nutrition to them in order to prevent the disease progression and complication development. The next part of a nurse is basically to make sure that the client is maintaining an adequate rest and sleep and activity cycle. Now, geriatric population, as I have said before, that they will be having a tendency to become dependent while performing the daily activity. Now here, the nurses are supposed to counsel the client and make sure that they are maintaining their independent functioning depending on their health status. They should plan a proper rest and sleep and activity cycle. The third important point when taking care of a geriatric client is maintenance of the hygiene. As I have mentioned, due to certain medicational usage for long term or certain disease condition or the natural aging process, the immunity of an individual in this age group will be declined. That's the reason it is considered that geriatric population are more prone to develop different kind of infection. That's the reason why the hygiene practice should definitely be ensured by a nurse here. While being in acute care setup, the nurse should maintain a hygienic environment, and also they are supposed to assist the client to maintain their personal hygiene. Simultaneously, while planning a discharge or in a community setup, the nurses will be teaching the client regarding the hygienic practice that has to be followed by them in order to minimize the chances of the development of infection. Now, till here, I hope you are completely aware about what are the nurse's role when taking care of a patient who is considered to be a part of the gerontological population. Now, here we are going to read about the role of the family too when coming to the aspect of taking care of a person who is belong from this vulnerable age group. Now, caregivers or elderly caregivers is an individual who generally provide a ongoing care and assistance to the gerontological client in need to support due to the physical, cognitive, and mental health condition which are very commonly seen among these clients. Now, caregivers itself are hidden patient in need of protection from physical and emotional harm, because you need to understand, as unlike us, the professionals, the caregivers who will be providing the continuous and ongoing care to the gerontological client or to the old age client in a home care setup for a long-term process, they are more prone to get physically and psychologically harmed. Prolonged period of caregiving to the client can cause stress and burnout. That's the reason here, although the role of a family member or caregiver is there in order to take care for the people who belongs to the older age group, but as a nurse, we actually should provide adequate information and support to the caregiver or to the ongoing caregiver or to the elderly caregiver who is going to provide our ongoing care to the older adult. Now, similarly, as a nurse or as a medical care professionals, how they are maintaining each one of the aspect of the individual client, the caregiver or the elderly caregiver also should be focused on those factors or aspect. So here the nurses plays a very important role for the caregivers of the elderly, that we are going to discuss it here, that what are the basic role of a nurse that they should play while dealing with a caregiver of an elderly. So first, whenever we are attending a client who is an older adult, if there is presence of any caregiver, we should perform the assessment for the caregiver. Second, we should provide adequate and all the important information to the caregiver. Third, as we are assisting the client to link with the available resources, we should definitely be linking the caregiver also to the available resources so that they can actually provide effective care to the client. We will be also intervening certain nursing plans to reduce the burden and distress of the caregivers of the elderly. We will be providing certain interventions to improve their competencies and confidence. We will also understand the potential risk for the harm, and we will be providing the necessary solution for them to the caregiver of the elderly. So in caregiver assessment, we should definitely identify the key caregiver, or we can say who is the main caregiver for the elderly client. We should assess the caregiver's role and relationship with the particular elderly client. We should identify the need of them. Majority of the caregiver will be having psychologically need because they will be psychologically burned out and drained out. That's the reason here identifying the needs of the caregivers also should be necessary. Many of the caregivers will be complaining regarding inadequate knowledge while taking care of elderly patients. That's the reason why the identification of the need of the caregiver plays a very important role for a nurse. So even when the patient is present in a clinical setup, we should include the caregiver in the planning, discharging, and providing care to the elderly. So if we are involving the caregiver in the clinical setup, they will be having a practical training how to take care of the elderly patient in the home too. Here, that's the reason nurses plays the most important role to bridging the gap between the caregiver and the elderly client. The next step is providing information. So here, as a nurse, we will be teaching the caregiver along with the patient. So as we have learned before that the patient and the elderly client also should be providing education. So along with the patient, the caregiver also should be educated by the nurse. So we would be explaining the necessary information in a very clear and understandable way, depending on their understanding level. Now, in some cases, the caregiver may require a physical and technical support to understand while dealing with the elderly client. So, as a nurse, we will be even providing a physical and technical support to learn all the techniques while dealing with the elderly client. So, we will be communicating even with the caregiver of the elderly patient to develop a cost effective plan of care and also achieve a positive effect or positive outcomes for the elderly client. We will be definitely linking the caregivers with the resources as we are doing for the elderly client. So here basically the supportive resources that can be natural or formal. Foremost, informal caregiver here will be definitely told to maintain a good listening skill. They should be empathic enough to understand the perspective of the elderly client, and they should be out of stress when taking care of the elderly client for a long-term basis. So that's how we generally will be educating the informal caregiver of the elderly client as well, in order to make sure that there is no abuse is occurring for the elderly client and they're maintaining their quality of life. So I hope till here we have learned about the nurse's role and responsibility when dealing with the client with gerontological age group. Also, we have learned regarding the nurse's role and responsibility in order to guide the caregivers of an elderly. So I hope you understood the whole concept and you have enjoyed the session. Thank you so much for attending this one. We will be meeting you guys to the next session. Foremost, our informal caregiver here will be definitely told to maintain a good listening skill. They should be empathic enough to understand the perspective of the elderly client, and they should be out of stress when taking care of the elderly client for a long-term basis. So that's how we generally will be educating the informal caregiver of the elderly client as well, in order to make sure that there is no abuse is occurring for the elderly client and they're maintaining their quality of life. So I hope till here we have learned about the nurse's role and responsibility when dealing with the client with gerontological age group. Also, we have learned regarding the nurse's role and responsibility in order to guide the caregivers of an elderly. So I hope you understood the whole concept and you have enjoyed the session. Thank you so much for attending this one. We will be meeting you guys to the next session.